Hey! So, welcome back for another episode of Secondhand Therapy. I am Nicole, if you're just watching your first episode now. And I do these kind of weekly sessions with myself after I go to therapy every Wednesday. And I really love my therapy, and I've learned so much and I've grown from it. And so I really want an opportunity to be able to share what I'm learning with you folks. So this week, I didn't actually get a chance to talk to my therapist about anything of special interest, or I can't say special interest, but of like actual relevance to my personal growth. Instead, what we talked about was something I probably haven't talked with a therapist about in a while, which is my emotional support pet, Paul. And Paul's over there relaxing, looking out the window. Maybe I'll see if I can get her on the video, but I have had Paul for 12 years now, since I adopted her. Yes, she was named after a Family Guy episode, so I named her before. I remember that calicos and tortoiseshells are pretty much always genetically female. So I adopted Paul, and she was just a kitten, and I've had her since 2007 after I graduated from college. And this cat has been everything to me. In fact, I'm a little bit afraid that I took her for granted for part of her life, but she's been amazing. When I moved out to Oregon, I brought her with me. When I moved back, I brought her with me. I actually have a really scary story about what happened. I mean, and it had a happy ending, but I had somebody steal her. A woman that I was living with actually had my cat catnapped and moved across the river to Vancouver, Washington. And the only reason that they bound her and returned her to me was because I had had her microchipped the month before, like 3 weeks even. And otherwise, she would have been gone. I wouldn't be sitting here doing this conversation with you, at least not about Paul. But it's my cat. She is wonderful. She just turned 12 years old. And I really wanted for her to be recognized as the gift that she is to me. And that gift really is that I deal with a lot of anxiety, and depression has been a big part of my life too. And sorry, also the lighting in here is a little wonky since it's starting to get darker earlier. But she's my sweetheart, and she has dealt, with me when I've been kind of at my worst. She knows when I need that additional support, and I don't feel alone here. I live by myself now. I don't feel alone when I come back. I know she's here. And I'm actually planning on bringing her. I'm going to Grace Hopper's Celebration of Women in Computing next week. And I'm going to be bringing her with me to my first conference. Grace Hopper isn't my first conference. That's actually my fourth time going. But I am bringing her with me. And this is the first time that I brought Paul to a conference. So she'll be staying in the hotel room with me, and she'll be flying with me. And so I have to face the logistics of how we're going to do that. So today what I want to talk about is emotional support animals, because they are wonderful and they bring us so much joy and comfort for the people who really find the benefit from them, of which I am one. So the process of actually getting an emotional support animal recognized as such is a little bit convoluted. Like if you were to go online and search for how to register an emotional support animal, you'll find a lot of different information, and you'll find a lot of companies, which is like, wait, what the hell? And everybody's trying to make a profit off of this. Basically, if you search for ESA letter, you will find lots of places that say, we'll give you a letter online. They just have to do like a quick video chat with you, and then they'll provide you with a letter. Some places say they have a registry. There is no central registry for emotional support animals. I've learned, fortunately not by the hard way, because the first route I went was to my therapist for getting a letter. But I had the resource available for a mental health professional to be able to write that letter for me. And the first letter that I had written was back in 2017, early 2017, when I was first seeing my first therapist here in Massachusetts, who was Marina, and she was happy to write the letter for me. She was actually the one that diagnosed me with bipolar disorder. brought up that idea that you seem to have kind of some fluctuations in your energy, and do you think they're tied to your mood? And once we start to dig in further, she was like, well, you may not be that different from your father in that regard. He struggled with bipolar disorder his whole life. And so with that anxiety and depression that comes along with it, you do need to get some kind of documentation from your mental health professional. That does not mean that they have to divulge your entire medical history or anything. They basically just have to, what they call prescribing, but I ran into a weird situation with that I'm going to talk about in a second. But I had let her know that I needed a copy of that letter, and that would basically protect me. And that went beyond what, I'm looking for the actual letter, so that maybe I can read it here for you. But I knew that with the letter, at least, I would be covered. All of these other companies are kind of doing their own thing. They offer an individual, unique just to them registry, and they give you a card. And if anybody were to question whether or not it's an emotional support animal, they can refer them to whatever company it is. And there are a bunch of them out there, as you'll see if you start Googling around. So it can get a little complicated, as you see, and it's confusing for people who are starting the process at first and thinking that they need, sorry, I really want to find this letter because it's a good idea for a template for you folks. But I went that route first to get the letter, and I guess I started to kind of go in a different direction, but I talked to my therapist and I basically said back in 2017, I have this pet. She really helps me with my anxiety and my depression. She's been like she's my companion, she's my partner. I've never had a relationship that lasted 12 years. I've never been married, so it's just, that's my baby. And I wanted to make sure that we really got across in the letter that there was, a need for this, and not leave any questions to, any emotion or I just typed emotional. Not leave any questions open as to whether or not she actually was needed. And here, let me see if I can find this. Hold on just a second. Oh, I found it. There we go. Okay, so I'll read that to you guys because my therapist now said it was kind of a haphazardly written letter in terms of considering liability. I'll talk about that in a second because we ran into that problem today when I went to go talk to her and see if she could issue an updated letter. But the letter that I had written back in April 2017 said, "To whom it may concern, Nicole Archambault is my patient and has been under my care since October 2016. I am intimately familiar with her history and with the functional limitations imposed by her disability, generalized anxiety." At that point, we were still kind of exploring, I think, the bipolar disorder. She meets the definition of disability under the Americans with Disabilities Act, the Fair Housing Act, and the Rehabilitation Act of 1973. Due to her debilitating anxiety, Nicole has certain limitations regarding socializing. In order to help alleviate these difficulties and to enhance her ability to live independently and to fully utilize her abilities to travel and live where she is most comfortable, I have prescribed that Nicole obtain an emotional support animal, and I would write the letter of certification. Having evaluated the effects of this request, I have determined that the presence of her cat Paul is necessary for Nicole's mental health because its presence will alleviate her symptoms of generalized anxiety by providing comfort and emotional grounding. If you have any questions regarding this request, please feel free to contact me. So that's effectively that's the wording that she used. And you could see most of those parts, the most important parts, if you're looking for a letter from your mental health professional that I would focus on. Sorry, my mouth's really dry. Cotton off. But the big parts that I would want to focus on if you're looking to get a letter would be how long they've been seeing you, the therapist, how long you've been under their care, because it's a concern you have to have in order for it to be considered an emotional support animal and have that letter written. it's only valid if that person is actually treating you in the state, I guess. There are like, I guess, some weird loopholes to that. I don't know if you could call it that, because there are these companies online where they can do a video chat with you and get you that letter for a cost, obviously, but you can do it for free through your therapist. So I would focus first on how long you've been under their care, how familiar they are with your situation, kind of tie it in there. Um, and we mentioned functional limitations imposed by the disability. Insert your disability here. And she made very clear that I met the definition of disability under the Americans with Disabilities Act, the Fair Housing Act, and the Rehabilitation Act of 1973. So I know that my therapist today, well, I'm not going to go into that just yet, but she did end up writing me a letter, my therapist that I saw today, and we kind of had to finagle it, but she made sure to mention that Americans with Disabilities Fair Housing and Rehabilitation Act. Mentioning all three of these does, I guess, not only give it some legitimacy, but it's the truth. You're covered under all of those. Due to her debilitating anxiety, so due to whatever you're facing, and then she identified that I have certain limitations, in this case, in regards to socializing. So in order to help her alleviate these difficulties and enhance her ability to live independently, and you might want to mention also to travel and live where you want, because with the emotional support animal, most locations will allow you to forego things like pet rent. And even if they don't allow animals there, they will allow you to actually bring in the animal. They're legally required to. So that's one of the benefits of having your animal, having this letter to substantiate that relationship between you and your pet. She used the word prescribe in here. And now I think it's time to highlight that in the story. So when I went to my therapist today, and this is a different therapy office than I had back in 2017, I emailed over a copy of the letter that I just read from 2017. And as soon as I came in today, I wasn't planning on using the whole day talking about this, but the ESA issue. But she said, so we have a little issue. I can't write this letter for you. And of course I was like, the hell you can't? Like, talk to me. And she was like, well, I ran it by the manager, basically the manager of the whole place, and we're concerned about liability by saying that we're prescribing this, because what if the animal scratches somebody or bites somebody? We'd be putting ourselves in the line of fire. That is not true as far as I can find. I think it might be it's a legitimate concern, but I did some quick Google foo, of course, right there on my phone, and found at least a couple of articles where they indicated that, in fact, I'll put them on the YouTube page, that mention, that exact situation. Right. I think there was a mental health professional that wrote into a website asking, am I putting myself in the line of fire here if anything does happen? And basically the consensus of the people who run the blog, also mental health professionals, had said it is very rare that you'll run into a situation where you find yourself to be liable for this. So it does happen that animals bite, and scratch, but legally speaking, you're more liable for the animal, as far as I know, than the mental health professional is. They have to be able to, animals are animals, if they didn't accept some sort of, not responsibility, but at least a role in the process of getting that emotional support letter to you, then we would never get emotional support letters. So with that in mind, we really talked about it, because I said, well, number one, you're my only mental health professional that I see on a regular basis. My neuropsychiatrist, I have not, or was she, neuropsychologist, I think. But the one that I went to basically to get an autism diagnosis for Asperger's, I don't see regularly enough for that to be an acceptable. I probably could, and they might not look into it, but I wanted to go to my regular therapist that I see every Wednesday. And we discussed it, and we didn't have the manager there, but what it came down to, she looked on a website and said that she had recommended that people get their animals registered on this website before. Well, I'm smart, okay? I ask a lot of questions and I do my research. So I looked on the website right then. In fact, we pulled it up on our screen, and Going through the FAQs and other areas, I was able to explain to her exactly what they were doing. They're trying to add some legitimacy to the emotional animal, the way that they appear. They give you a little vest, they give you a card. But the bottom line is that if you don't have that letter, they're not an emotional support animal. You know, like, I don't know what the process exactly of getting your animal onto one of those registries for the emotional support animals is, because I haven't done that yet. And they do charge you. They'll charge you, like, I've seen $80 for the majority of it. And then you can add on and premium or whatever. They're definitely, you know, making some coin off of our emotional support needs. But they made it very clear in their FAQs, which she had not read, that the only way to be able to really legitimize this is, and to make it legal, is to have that letter. And you need to have a letter accessible, ideally printed out. I'm going to have it printed out when I go to fly. But the benefit of having that ESA letter with flying, I'm flying with JetBlue, and they actually have they have like 3 pages, I think, of a form, and I'll kind of mention those too. But having that letter on hand, and in case they ask for it, you have to have it available. It's more important than any kind of registry that you can put them on. And I don't even know that they check for that letter. I know they did like a package where they'd have a doctor write you a note, and they would get you on the registry and the vest and the card and blah, blah, blah. I might do it eventually, you know, just to add that legitimacy, but they do add the disclaimer in their FAQs that if you're asked for that letter and you don't have it, it doesn't matter if your cat or your dog has a fancy vest, it's not an emotional support animal, bottom line. So they're really trying to protect themselves there, because otherwise anybody could go on and, you know, get that emotional support animal registration on, you know, some kind of registry. But that letter really is the most important part, and you have to have a mental health professional in order to get it. So I plan on doing this entirely the legal way. My therapist and I, after we talked today, she agreed to what we did. She rewrote one, and I'll read that one next week too, probably. She rewrote it, but she left out the word prescribed. And I think that she recommended, or I can't remember the exact wording she used, but she had basically recommended, based on all of it, she mentioned, you know, based on my emotional needs and my support needs, you know, there's no question that my cat is amazing and amazingly supportive for me and very helpful with my mental health. But you got to be able to convey that in a letter. So all in all, we covered it. Also to mention, not a small note, you have to have it on letterhead. So it has to be the office's letterhead on there. They will not just accept some letter written up, you know, in Microsoft Word with no, you know, header on it. Anybody could do that. And you have to have the phone number and the information for your therapist. And it also has to be signed. This, she didn't actually put in the letter that I had back in 2017, isn't entirely valid because she didn't include her license number. So they have to have the license number on there as well. Very important. Again, I wasn't really, you know, pressured for anything before when I flew, and I didn't have to pay the extra $100 or whatever each way to have her fly with me. But I didn't really get any hassle originally. JetBlue, however, has 3 different forms. It's all in kind of one packet. First form is your customer verification, basically, of the animal's behaviors. So that tells you right there, and they say at the bottom that you're accepting responsibility. That pretty much means the buck stops there. You know, like, they're not going to go after your therapist. How would they have known? It's an animal. So the animal being with you regularly means that you can probably vouch for its behavior. Even then, we can't control how animals behave. So just make sure that your animal is, you know, what we would call like bomb proof, that if something happens and child screams or something, you know, like, they're not going to freak out. And my cat is very sensitive to loud noises, but fortunately she doesn't like respond in an angry manner. In fact, sometimes I think my cat has autism too. We're like perfect together. She's so weird. Her stimming with the biscuit blanket, she loves to knead on those microfleece blankets, and it's so cute. But my autistic cat and I can vouch for the fact that she is very docile otherwise. So in addition to that, since I discovered the medication gabapentin, I had never heard about it before, but of course, like everything else, it can be used as a street drug, apparently. But gabapentin with animals is a sedative. So I was able to obtain some from my veterinarian, and it was like $20 for like 8 pills or something like that, or five. You give it to them the night before, and then like 2 to 3 hours before traveling. And I give it to her before the vet's office, otherwise she's screaming the entire time. She does not like traveling. She doesn't like being put in her carrier. So I'm going to be traveling with her basically doped up. So that should make it considerably easier. And it wears off very quickly, after the time period too, usually like 3 to 4 hours, until they're kind of like back together. So it's not a long-term effect thing. So the first letter is verifying that I can vouch for that. You know what? Let me grab it really quick and I can read it to you. Because it is right there. Let's see. So the first page, we're looking at customer confirmation. And remember, this is just for JetBlue. So different airlines are going to have their own different forms. And if they don't have the form, have that letter. If you want to go ahead and get the vest and, the card and everything else, that's great. If they don't ask any questions, cool. If they do ask questions and ask for that letter to cover their asses, well, even if you have this filled out, you're probably going to need something, but they have a form either way. So the first form is the customer confirmation of emotional support / psychiatric service animal behavior. And their questions are, or please check the boxes to confirm. 1, I confirm this animal has been trained to behave appropriately in a public setting and takes my direction upon command. 2, I understand that if this animal behaves inappropriately, it will be considered unacceptable for travel and will be refused transport and or will be removed from the aircraft, and JetBlue's pet policy and fees will apply. 3, I confirm this animal will fit within my own personal space / within the seat space I purchased. Customer may elect to purchase additional seats to allow more space for their animal. 4, I confirm that this animal shall not occupy any seat. Animal must remain on the floor or entirely in your lap if no larger than a lap infant throughout the flight, if size requirements permit. I'm going to have her on my lap, which is I love it. She loves being close to me. 5, I take full responsibility for the safety, well-being, and conduct of this animal, including the animal's interactions with other animals and or individuals. 6, should this animal cause JetBlue or its customers any loss, injury, damage, or expense of any kind, I consent and acknowledge that I will accept liability for any such loss, injury, damage, or experience. So that makes it very clear that I am responsible in the event of something happened, which as a pet owner, you kind of got to accept. I don't think that there's any kind of insurance for behavior as far as I can tell. So at least I ain't got it. And the last one, I consent that the Commonwealth of Puerto Rico, the state of Hawaii, foreign countries, and inbound international travel to the United States have specific pet travel requirements, and that JetBlue's pet policy has requirements, including but not limited to size limitations and breed species limitations. So then you sign, and they got to be assessed, I guess, for I don't think a whole lot of this is going to really apply. The second form is the veterinary health form. So the veterinary health form is effectively what I just took my cat to the vet, and they filled this out for me, all the information from the vet saying the animal, they have to check off the animal is not bitten, scratched, or otherwise injured or attacked any person. They're checking for a rabies vaccine. You have to enter the date for that. The veterinarian's name and license, date of expiration, and then they have to sign and fill out their information as well. So I got that done. We're good there. And it still cracks me up whenever I look at a form here. It's like Paul Archambault. The last form, though, is the medical / mental health professional form. And you have to enter your customer information at the top. And then there's medical mental health professional information where they enter their license. And again, they got to fill this out. Medical license, their NPI, their provider identifier, where, the name of the practice, their signature. And then there are 2 check boxes here. 1, I'm a licensed medical / mental health professional treating this patient's mental or emotional disability. And 2, I certified this patient has a mental health related disability listed in the Diagnostic and Statistical Manual of Mental Disorders, the DSM, and is currently under my care for that mental health related disability, both of which are true in my case. So this, and it should give you some insight in general, looking at these questions, but every airline again is going to be different. So it's something to take into consideration, and we're adding that letter. She's going to fill out just the form that they have for the mental health professional, but we still need the letter as well, or at least I want the letter to be completely legitimate. So that's some insight into the process of having an emotional support animal and what you basically need to do to fly with your animal, to travel. Just driving around with your cat, sure, if you just want to do that, is fine. Even probably crossing state lines. I'm going to be going to Orlando, Florida for the Grace Hopper Celebration of Women in Computing next week with the Untapped Pathways Grant. Thank you very much, Nita Borg. And it's a 25,000 person conference. Oh my God, just saying that I want to die. But it's huge. It's massive. And it's a mile walk from one end to the other. Paul's going to be alone for a lot of the day, but I will be back for a good period of time because that's basically the way that I have to deal with it. I can't be over there for the entire time. Unfortunately, I'll kind of be back and forth. But yeah, I can't be over there for the entire time. It just ain't happening. So she'll get plenty of time with me and we'll be spending the evening together. Oh, one more thing I might want to mention. It's kind of divergent from the emotional support animal thing exactly, but it is relevant in if you're looking to travel with your emotional support animal. I was trying to figure out, I'm like, what am I going to do for a litter box? What am I going to do for food? What am I going to do for blah, blah, blah? What I'm actually going to do, I have to call up Chewy as well. I love Chewy. Oh my God, if you haven't ordered from them, they're amazing. Customer service is A+. I am going to call them up and kind of ask for their advice on it because I know they've had people traveling with pets, with cats specifically before. They have disposable litter boxes, and usually they come in a pack of 2 or something. Maybe I'll leave the second one with them so that, you know, they're not going to give it to anyone else, but I don't know, to dispose of at least. And I'm going to have that package delivered hopefully the day before. So it should be there at the hotel where I'm staying. They're allowing my pet, and so I'll be able to have that biodegradable, disposable litter box there. We're only going to be staying the 1st through the 5th, so it shouldn't be a big problem. And then when you leave, you leave. You know, I probably won't keep like a poop scoop, or maybe there's like a little one that I can get or something that I could put in a plastic bag and put in my suitcase because I'm not weird about that. I am going to bring probably my own food, a little baggie of food. She only eats probably about half a cup to 3/4 of food a day. So I'll make sure that she has her food, that she has water. And yeah, I think it's going to be great. And if you're going to be at Grace Hopper Celebration of Women in Computing, number 1, please leave a comment. Let's see if we can, you know, catch up with each other, meet each other. And number 2, what was number 2? Hi. But yeah, at least we'll be there, and hopefully that gives you some information about what the emotional support animal process looks like. Thank you so much, guys, for tuning in today. Interesting topic. I don't know what we're going to be talking. Oh, wait, I'm going to be gone next week. So I actually won't have an official therapy session, but I think it would be kind of good to do a session here anyway, just to, I don't know, maybe check up on my mental health status while I'm at such a big event. But either way, thank you for tuning in. Be sure to subscribe, and bye, guys.